Hi friends, happy Friday. I wanted to join you for a Facebook Live to talk about low back pain. So of course, day to day, I see back pain on a regular basis, pretty much a daily basis. And I see everything from acute low back pain to chronic low back pain. And I'm sure that if you're watching this or if you watch it later, whether you've had low back pain or your friend or family member or coworker has someone that you know or yourself has had low back pain, and you can totally appreciate this whole video. And I think it's really important to just kind of classify acute versus chronic pain, and I want to talk about the course of low back pain, especially in America, what happens. So if you've had low back pain before, you know that the typical course of treatment is you go to your doctor, your primary care, and they will give you a pain medication and or a muscle relaxer. You leave the doctor's office and you take the medication as prescribed, and then the pain does not go away. You still have low back pain. So then you go back to the doctor and the doctor says, I'm gonna refer you to a specialist a spine doctor. So then you go to a doctor, you get ordered an x-ray first, because an x-ray always typically comes before an MRI. You get an x-ray which shows absolutely nothing, that potentially you have degeneration. So you get an x-ray, then the x-ray doesn't show anything, so then you get an MRI. So of course the insurance bills are racking up because you're going through all these doctor's appointments and imaging and medications. So then you get the MRI, and guess what? It shows that you have a bulging disc, a herniated disc, potentially you have degeneration, and you freak out and you don't know what to do. So then it's, okay, do I go to PT or do I go to a chiropractor or do I need to get surgery? So you're kind of going through all this chaos and everyone's telling you to do different things. You stop moving, you stop doing what you normally do. You don't exercise, you're afraid to move because the fear sets in. And then after that, you may decide that you figure out a course of treatment. But at that point, you've wasted so much time. So we're talking maybe a month up to 6 months of trying to go through this process and totally changing what initially was acute low back pain to now what is considered chronic low back pain. So I want to talk a little bit about that. So acute low back pain is you bend over to pick something up and you have this sharp pain and you're like, oh my gosh, this is terrible. What am I going to do? Sometimes people say they fall to the ground. Sometimes a lot of times they'll say, I was just picking up a pencil and I felt this excruciating low back pain. But what happens during that time is that you get fearful to move, and your autonomic nervous system always wants to feel safe. So safety and stability go hand in hand, always wants to feel safe. So as you begin to have more fear of movement, then your nervous system is not safe, and then you do not stabilize as well. So every time you go into this protective mechanism of, I'm afraid to move, I'm afraid to bend, I'm afraid to twist, then what's happening is it's making things worse. So my first piece of advice is to make sure that if you have low back pain, an acute episode of low back pain, that you continue to move, and I've said this in a previous video, as normally as you can. I'll talk a little bit more specific about some other things, but you want to try to continue to move and not rest. So you're not gonna lie in a bed, lie on a floor for a really long period of time. You want to move because you want your nervous system to say, okay, no big deal. It was just pain, which is a warning signal. I always call pain your yellow light. It's your warning signal. And yes, something was wrong. Something wasn't moving correctly in the body and you had this high pain signal, but it will go away if you continue to go back to your normal course of life. So with chronic low back pain, which is actually about 85% of cases is considered chronic low back pain, not acute low back pain. So meaning that most of the people that, whether you're watching or again, a friend, family, coworker has chronic low back pain, which you can define that as greater than 3 months. Chronic low back pain is completely different, where there is no tissue damage. However, we have what's called chronic sensitization in the nervous system. So the nervous system is having, think of it as like this hyperreactivity, that there's these increased pain signals all the time, but nothing is physically wrong with the back at that point. So going back to what I talked about previously is that if the more that you have a fear of moving, then the pain signals, think of them as they're kind of firing more and more, because now you're doing less, you're not doing the same activities you used to do, some of the enjoyment of life has been taken away. So the pain can get worse and is signaled all the time. So when I'm evaluating someone, it's really important to me to say, when do you have pain? So I like to be super objective. So do you have pain when you sit? Do you have pain when you stand? Do you have pain when you sleep? Etc. Whatever other activity it might be. If someone says, I have pain all the time, then I already cue in, and of course it might be over that 3-month period. I know that they're in this chronic pain state, which is completely different. My treatment, my course of actions, and their course of actions are completely different, because this is a person that needs to begin to start to move, begin to start to return back to the activities they used to do. I need to help them with taking away some of their fears of having low back pain again. That could be dialed more towards meditation and mindfulness and things like that that can really help with their ability to move past this. But whether you have acute low back pain or chronic low back pain, it is in fact, I'm saying this anecdotally, it is one of the easiest things to treat. The hardest component is getting someone to believe that it's going to be okay, that you don't have to live in pain, that this is something that your body, your nervous system is kind of adapted to this. But you don't need to feel this way, and you don't need to be fearful of movement. So it's kind of interesting because, like I said, it's so many people experience it. But when I have somebody with acute low back pain, I can treat them in 1 to 2 visits, and they are typically pain-free. And I'm going to talk a little bit more specifically about that. So when you have acute low back pain, that is actually the time when a manipulation is appropriate. And I did a post I think a few weeks ago about we are not moving bones, and we are not just, putting things back into place. But what happens with a manipulation is we are creating this neurophysiological response. So think of it, it's a relaxation response. So it kind of just chills everything out. And that's what the nervous system needs to decrease their pain signals. Because when it's hyperreactive, when it's super painful, then we need to think of it as like we need to calm everything down. So in a PT session, when someone comes in with acute low back pain, I follow a clinical prediction rule to see, are they appropriate for a manipulation or not? Do they have enough hip mobility? Do they have radiating symptoms below their leg or not? Have they had it within a 16-day window? And so I'm going to go through my checklist of is this person appropriate or are they not? And then I make my decision. If someone's had pain for 6 months, sure, could I do a manipulation? I could, but are they going to really benefit from it? I'm not too sure about that. That's when I'm really trying to focus, and that's what the research tells us as well. I'm going to focus more on exercising and moving and breathing and trying to really get them back to an optimal state, just returning to their life. The second thing that I will always do is I'm teaching them diaphragmatic breathing. So diaphragmatic breathing, one, is going to inhibit the pain. So that is one of your most powerful things to do to inhibit pain immediately, based on pressure changes in some of the receptors in the viscera. So when they practice breathing, you're not only getting inhibition of pain, but you can also be improving the stability and the sequencing and coordination and timing of all of the core musculature. So that's going to be super powerful for somebody that has acute low back pain. I oftentimes will do some other manual muscle testing to figure out what other relationships might be happening. Why did this happen to begin with? Of course, that's what I'm always looking for, is the root of the problem. But really trying to reintegrate them as quickly as possible. I use rock tape as a reinforcement. Sorry, I have hair in my face, which is just a kinesiology tape, which just provides input via the skin to again give someone this sense of safety. So we have 500 nerve cells per square centimeter of skin. So we're giving input via the skin to the brain to again kind of give this sense of safety to the area. So typically people will respond really well within 2 to 3 visits, and they're like, hey, I feel great. And then, if we continue to be able to work on things that caused it in the first place, awesome. But if not, they're back to their normal life. The reason I tell you that is I want you to know how easy it can be to treat an acute low back pain, and how when we go through that long process of going to get pain medication and going to get, MRIs and x-rays, it's completely unnecessary and prolongs the period of time that you are experiencing pain, which then takes you into the chronic pain, chronic sensitization of the nervous system, chronic pain state, which then is much more difficult to work through. So to speak a little bit more about MRIs and imaging, for a while, there's been lots of research to support this, and I'm always educating my patients on it. And I think it's really important to understand this, is that people come into me all the time and say, I have a herniated disc at L5-S1. In my mind, I don't say this, but in my mind, I'm like, it doesn't matter. I don't really care if you have a herniated disc. That is not what is causing your problem. You just happened to have an MRI that showed a herniated disc that most of the time does not even correlate with symptoms. So anybody over the age of 30, 35 that gets an image, it is absolutely going to show degeneration, bulging disc, herniated disc, you name it, you're going to probably see it on an image. I always give the analogy to my patients that if you had 50 people in a room and 5 of them had symptoms and the other 45 did not have symptoms, you would look at all their MRIs and they would all show something, but 45 of them do not have any symptoms. And that's where the research is showing us that we cannot even correlate, you have this injury and this is what it shows up on the MRI. It is rarely, 1, MRIs are interpreted incorrectly all the time, and 2, again, it's completely unnecessary, because then what happens, if I go back to the chronic pain state, now someone's attached to their diagnosis that isn't even accurate. So when, again, somebody comes in, well, I have degeneration in my back. My spine is flat, which does not mean anything, by the way. So when people get x-rays and it shows that their spine is flat, there's no research to support that that is going to change their pain symptoms. So when it's so important to recognize that I don't even look at MRIs anymore, because to me, it's completely invaluable. I want to see how someone moves, how someone feels when they move, what is causing their pain, what's provoking their pain, what's making their pain feel better. So like I said, there's rarely a correlation. And just know that everybody is, I always call them abnormal normal findings. So we are all, like all of you watching, if we all got an MRI, we would absolutely see things on there. And we would freak out, right? I would freak out if I saw like, oh my God, I have herniated disc at L5. So, unfortunately that happens by default because you have to get other imaging, but it really should be the last resort. It is for us as physical therapists and, I'm speaking for all my colleagues and chiropractors and other professionals, it's easy for us to evaluate and figure out what's going on and be able to give you an appropriate treatment. So you might need to find the right professional, and that's okay. It doesn't mean that all PTs are great, all chiros are great, all body workers are great. You need to find the right professional, but I do want you to know that when you do, it is something that is very treatable. The last thing I wanted to talk about is, let's see, I had my little list. All right, I think I might have hit most of the things. Okay, just the last couple things of fear of low back pain. So once you've had low back pain, then of course, again, I kind of touched on this, is you get nervous and you feel like, oh my gosh, is this gonna happen again? And the reality is that sure, it could happen again. You could bend over the wrong way and you could feel feel some pain, but you have to know that it is just pain. That's all it is. And it's just a signal. It's just saying, hey, something's not right in the body. You need to kind of work on, you need to figure it out. So pain is actually super helpful, and it gives us information. That's what it is. It gives us information. So you want to use that information and say, okay, why did this low back pain happen in the first place? How is my body moving? Am I breathing correctly? Am I stressed out all the time? Am I not getting enough sleep? All the things I talk about all the time. Are you eating well? All of those factors are going to factor into whether you have this high reactivity to pain, or you can objectively look at it and say, okay, my knee hurts. All right, I wonder why that's hurting. Oh, maybe I ran too much yesterday, or I sat for 9 hours yesterday. And be able to just look at it objectively instead of thinking, oh my gosh, the world's going to end because I have low back pain. Because when you have, so everyone's looking for the diagnosis. And as a PT, when I first started, that's kind of how I learned. So I would, in our assessments, we would write signs and symptoms consistent with herniated disc, degeneration. And what I've learned in my evolution as a clinician is that it doesn't matter. So when people ask me, what do you think it is? Especially with low back pain, I'll just say, you have pain. It's just, there's some movement issues going on, and I'll explain what's happening and kind of why it's happening. But it doesn't matter if it's degeneration, lateral foraminal stenosis, herniated disc, bulging disc. It really doesn't matter, because again, what we're looking at is how is it presenting on you. So I don't like people to be attached to a diagnosis at all, because that attachment to it of I have whatever, can just really negatively impact your thoughts, your emotions, your beliefs about pain, and can easily take you to the chronic pain state where you have pain all of the time, that it never changes. And I sometimes it's really hard to educate people, and everyone's not in the right mindset to be open to hear it, which is why I wanted to do this Facebook Live, to try to get the message out of, about imaging and why we don't really need it unless special testing shows us that you might potentially have a fracture, or there might be a tumor. But again, we can determine those types of things. We can't find out if you have a fracture or a tumor, but if your symptoms aren't consistent with normal testing, then that's our responsibility under licensure to be able to say, you need to go get an MRI. But right now they are so overprescribed, and it's ruining. I truly believe it's ruining like so many people, and it's just ruining the thought process of what's supposed to happen, and people are walking around in pain that don't even need to be in pain. So I think I hit all of my key things. If I didn't, you can feel free to message me, or you can post in the comments below. But I hope this was helpful, and I could probably talk about it for many more hours. But for now, I'll leave it at that, and I will catch you hopefully next week. All right, thank you guys. Have a great weekend. Bye.